Good Wednesday morning, everyone. It's 10 o'clock and time to get started with today's session where we'll help you prepare a bit more for the AHIP exam. Just dropped on Monday, it was released on Monday. You're able to take it now, although we'd recommend you wait until at least the 27th so you can take advantage of carrier discounts. UHC's, for example, their AHIP carrier discount opens up on the 27th. But all that said, we want to help you get ready for that exam, give you a little bit of a refresher on all those kind of niche topics you might run into here in Medicare. Make sure you're ready for it. My name is Randy Lobert, Growth Marketing Manager here at Action Benefits, and my job is, or part of my job is to help you grow your books of business. And part of doing that is helping you get ready to certify, get ready to sell, and make sure you know your stuff. Joining me today is a lady who knows all the stuff. Debbie Brown, go ahead and say hi to everyone.
Good morning, everybody. Welcome. I'm glad you could join us, and looking forward to what we've got ahead of us. Take it away, Randy.
And thank you for joining us here this morning, Debbie. I would wager that between Debbie and I combined and the individual teammates who are hanging out in the room with us as well, you will get your Medicare questions answered today. If you have the most off-the-wall thing, if you can stump us today, in fact, let's make that wager. If you can stump us here today, I will send breakfast to your office at a time that we'll figure out. So go ahead, keep those questions coming. We want to make sure you feel good and prepared about things. Let's get going down the road here. Three things we want to attend to here today in this session in the next 15 minutes or so. First, we want to make sure you can identify some special cases where a beneficiary can enroll in Medicare. So we're going to take a good look at special enrollment periods and pretty much everything outside of AEP. You probably know AEP pretty well. We'll take a look at GEP and all those sorts of things here as well, just to bubble them back up to the surface for you before you take your AHIP exam. Second, we'll take a look at LEPs and when they do and do not apply, particularly around cobra, those sorts of things. Lots of good conversation around that. We'll also take a look at Medicare and how it coexists with both private coverage and other public coverage as well, like TRICARE and those sorts of things, to make sure you can really dig in on those questions you might face as part of your AHIP preparation. We also want to know, although today is built as a refresher, we're always curious about who's in the room here with us. There's a few names I'm not as familiar with here today. So I'd like to know which of these statements best describes you, and please put the letter that best describes you in the chat. Is it A, you're brand new to this market? B, you have experience in this market, but you're new to working with Action Benefits? C, you have some experience with Action in the Medicare market, but could use a refresher? Or is it D, you're a seasoned pro, you just love spending time with us, you rolled out of bed today and said, Randy, Debbie, and Medicare, those are like three of my favorite things, and I could not think of a better way to spend an hour. Go ahead and put the letter in the chat, just as some of you are, please. All right, good mix of folks who with experience in the market here. For those of you new to working with Action Benefits, welcome aboard. We hope this is a fantastic introduction to some of the support we offer to our agents and the broader agent community as well. And for those of you that just love working with us, like Olivia, Steve, and Margaret, and Dave. Hi, Dave. Thanks for joining us here this morning. We love you too. Coming right back at you. Let's go ahead and get started with our hour here today. That helps us, by the way, figure out where exactly we need to tweak a few things throughout the presentation. But because today is primarily built as a refresher to get you ready for the AHIP exam, we will kind of make sure we attend to all the basics throughout the session. So we're going to take a look first at enrollment opportunities, look at a variety of rules around those to help you get rolling and get going with that portion of the AHIP exam. And as veteran insurance agents, you know that there are no fewer than 5 different enrollment periods that a beneficiary may take advantage of to enroll in Medicare. So let's give you a quick crash course in those. And if there's nothing else you screenshot today, it's going to be what's fully revealed on the screen here in just a moment. That initial enrollment period is your enrollee's first opportunity to be exposed to Medicare. That period is really built, generally speaking, for those who are turning 65. And during that time, they can enroll in parts A and or B and enroll in part C or D after, of course, they've enrolled in parts A and B. And as agents, you probably make a lot of your living during those 3 months before their 65th birthday, the month of their 65th birthday. Say that very fast. I can't. And the 3 months after their 65th birthday as well. So you've got those 7 months that you're working with in that IEP. We'll talk about a few nuances, though, with that in just a moment. There is also, of course, the general enrollment period, really built for your folks who have missed that initial enrollment period. During that time, they can enroll in Part A and or B as necessary, and that period runs yearly between January 1st and March 31st. There are special enrollment periods that your folks can use. Generally, people are granted a special enrollment period to enroll in Medicare Parts A and or B because their previous employer-based coverage has ended, and we'll talk about that in a bit detail later on. They can, with that special enrollment period, they can enroll in Parts A and or B. And the key thing to remember here is that that special enrollment period for enrolling in Parts A and or B is 8 months from the termination of that employer-based coverage. And that comes into significant effect when we talk about cobra enrollment and coordination a bit later on here today. AEP is where you get to talk to all your clients and have all kinds of fun. That's built for Medicare enrollees. During that time, they can enroll in or change their C or D coverage. And that runs, of course, from October 15th through December 7th. And then there's that Medicareadvantage open enrollment period, which just passed, built for those who are already in a Medicare Advantage plan and only for those in a Medicare Advantage plan. During that time, they can make a one-time change of that coverage, and that also runs January 1st through March 31st. So if you screenshot nothing else today, take no other notes, this is a good desktop reference to have. If you were to walk around our cubes, you'd see it on most of the individual teams' cubicles. Always a good thing to have in mind just to have your dates going forward. We are going to talk a little bit about some nuance here with the initial enrollment period and then go into a few other all of the other periods here as well. Two big things to remember as you are working with folks who are aging into the program. There are cases where they'll be automatically enrolled in Medicare Parts A and or B, and there will be cases when they have to take action to enroll in Parts A or B. For those who are looking at automatic enrollment, here's some of the criteria you'd want to look for. If they're already getting benefits from Social Security or the Railroad Retirement Board, or RRB, as I'll call them throughout the remainder of this little portion of the session, they will automatically get Parts A and B starting the first of the month prior to turning 65. If they are under 65 and have a disability, they'll automatically get Parts A and B after they've had disability benefits for 24 months. So the beginning of the 25th month is when that will happen for them. And if they are eligible at any age with ALS or Lou Gehrig's disease, they would get Parts A and B automatically get Parts A and B the month their Social Security disability benefits begin. So those are those automatic enrollments. Generally speaking, if you're already getting Social Security benefits or already getting disability benefits, they will be automatically enrolled in Parts A or B when the time comes around. But as people work later and later in life, it's not as common anymore for people to be on Social Security when they age into Medicare. So generally speaking, a lot of your beneficiaries have to take some sort of action. They have to manually enroll in Medicare here. So if they're approaching age 65 but not getting benefits from Social Security or the RRB, they need to contact Social Security 3 months before they turn 65 to start that enrollment process here, or ideally 3 months before they turn 65. If they're enrolling with ESRD, or because they have ESRD, their IEP begins the month that beneficiary is diagnosed and lasts for an additional 3 months. So as soon as they have that end-stage renal disease diagnosis, it's imperative that they start that enrollment process right away. Talked for a few minutes here. Want to make sure you're on the same page with me. So in which of the following cases will a beneficiary need to take action? And I just love saying that because action benefits. Okay, that's my joke for the day. That's the only joke you get. In which of the following cases will a beneficiary need to take action to enroll in Medicare Parts A and B? Please choose all that apply here. Is it A, if they're not already receiving Social Security or RRB benefits and they're turning 65? Is it B, if they're not receiving Social Security or RRB benefits and is turning 65? C, if diagnosed with ESRD at any age? And D, if they're receiving disability insurance benefits for more than 2 years? In which case will someone need to take action? In which case will someone need to visit their Social Security office in order to enroll? Please put the letter that describes for you. All right, just catching up with the chat here. Thank you, Debbie, for answering Margaret's question. Oh, Debbie, you answered Margaret's question privately to me. So let's check in with that real quick. By the way, for those of you saying B, if they're not receiving Social Security benefits entering 65, yes, they would need to take some action to enroll. Margaret Harris, though, I have several Margarets in the room here this morning. Margaret Harris asked, is the Part B premium paid by someone else for those that get Medicare because of disability? Debbie answered, well, Debbie, do you want to unmute and give the full answer there?
Sure. So with the Part B premium, everybody's going to be responsible for it. Unless, of course, they're on Medicaid, then they may get assistance, get the full Part B paid for or partial of it. But yeah, if you're on disability, just disability, you're going to be responsible for that Part B premium.
Yep. Excellent clarifying question. And for more information about what Debbie alluded to, about how beneficiaries can get support with their Part A if they have to pay one, or their Part B premiums, we do have a session on Medicaid savings programs coming up in the middle of next month. Don't press me on the date at the moment, but it will be on the training calendar that pops up on your screen in just at the end of today's session. Onward. Let's talk a bit about that general enrollment period. There's not a ton to say here, but there's some things just to keep fresh in your brains. And that is that the general enrollment period is really built for folks who did not enroll during their initial enrollment period. So during that 7-month window we just talked about. If you missed that window, you've got to wait till the next GEP to sign up for Parts A or B, unless for some reason, typically because their employer-sponsored coverage terminated, they qualify for SEP to enroll. That period does take first between January 1st through March 31st each year, but be wary. People enrolling during this period generally are subject to an LEP, depending on how long they went without coverage. We'll talk about LEPs in just a moment, but that's one thing to keep in mind. Whenever you hear GEP or you have someone that's taking advantage of that, always got to be thinking about how you might talk with them about LEPs and plan for those as they go forward. One thing, a fairly recent change. So for those of you who've been around the block for a while or around the block a few times, you might be used to GEP coverage or coverage you get during GEP starting in July. That's no longer the case. Instead, Medicare coverage becomes effective the first after the month of enrollment. So if they enroll in Medicare on March 28th, they'll have Medicare Parts A and or B effective on April 1st, which is super nice. They don't have that gap in the effective dates any longer. Let's talk a bit about SEPs here as well. Generally speaking, again, we've talked about employer-based coverage. Want to give you a little few more details there. Generally speaking, the SEP or someone is eligible for an SEP when the beneficiary or their spouse is actively employed and the employer group health plan consists of more than 20 members, or they're disabled and working for an employer or group with more than 100 employees. You may be eligible for an SEP, or your clients may be eligible for an SEP if they are qualified for Part A and B and they were a volunteer serving in a foreign country. So say you missed your IEP, right? And you were serving overseas in the Peace Corps or whatever, which, you know, hats off to you, all the salutes we can give. And you come back, you may get an SEP for that working with this if you work with your local Social Security office. SEPs do not apply though, and this is one thing where you can save your clients a lot of headache and potentially a lot of cash. SEPs do not apply when retiree or cobra coverage ends. Neither retiree benefits or cobra coverage are considered coverage from active employment by Social Security and Medicare. Pardon me. So it's important to make sure that just the end of cobra coverage doesn't grant them the ability to enroll in Medicare Parts A and B. Always good practice to enroll as soon as we know that's eligible. We'll show you more on that in a few moments here. SEPs are, and also when you're looking at enrollment reasons, some folks often fill out those applications, fill out the paperwork based on ESRDs, and they say, "Oh, I have this qualifying condition. I'm using an SEP to enroll in Medicare Parts A or B." That is a really fast way to get those applications denied. They're always, when they're applying on reason of having end-stage renal disease, they are taking advantage of their initial enrollment period in those cases. Looking at employer coverage, though, that SEP can be used when even when your person is still covered by a group health plan, inclusive of even if they're enrolled in retiree benefits, and within 8 months of the loss of coverage of employment or employment, whichever of those comes first. We should mention, though, that because we're talking about SEPs here, the SEP for enrolling in Medicare Part B is way different from looking at Part C and D, right, where coverage ends. So we want to make sure we're very clear about those. So an SEP, for example, for someone losing Part B coverage, or sorry, for losing their employer-based coverage, yeah, they have the 8 months to enroll in Medicare Part B, but they can't have a gap in creditable coverage for more than 63 days, right? So if they've completely lost that group health plan, they've only got 63 days to get creditable drug coverage, meaning they'd want to enroll in Part B, Part A and or B, so they can get Part D later on. And if they want to pick up a Medicare Advantage plan, again, that has drug coverage there as well. There is a 63 day limit from the loss of coverage date there. So lots of things to keep in mind there. Generally speaking, as soon as you know the loss of employer-based coverage is going to happen, you want to get on the ball with that beneficiary, and they want to get on the ball with that so they can make sure they aren't assessed any late enrollment penalties. But there's been a few minutes of Debbie and I talking here. Want to check in with you here, make sure you're on the same page with us. Which of the following statements is true regarding the general enrollment period, GEP? Is it A, beneficiaries can enroll at any time throughout the calendar year? B, the period is designed for beneficiaries who may have missed their initial enrollment period? Or C, the period lasts for 8 months from the end of any employer-sponsored medical coverage? Go ahead and put the letter you're thinking in the chat, please. The general enrollment period, GEP, is only those 3 months at the beginning of the year. So it only lasts from January through March, and it is built for folks who may have missed their IEP. Special enrollment periods is that 8 months that you might have in mind if you might have said C here going forward. So a little tricky here, but good conversation, right? Making sure we're all on the same page. Debbie, what else do we need to add about IEP, GEP, or SEP that we haven't talked about just yet?
You pretty much covered everything, but just keep in mind that whole thing about when they go on Cobra, signing up within the 8 months, and also keep in mind that when you're on Medicare, you go on Cobra, Medicare is going to be primary, which means that if you don't have Part B, you're not going to have medical coverage. So it's very, very important to make sure your clients get to the Social Security office and get signed up right away. I know that Margaret had a question about, yes, the OEP, AEP, they all kind of run in together, but that's how it's been for the many years I've been doing it. So that's generally how it goes. And then GEP's been around forever. So GEP is actually Medicare's open enrollment, not the carrier open enrollment. It's the Medicare open enrollment. That's what GEP is, which runs from 1/1 to 3/31 every year.
Yep. And again, that's really built for folks who don't have yet Medicare Part A or B and need to enroll so they can qualify for the other Medicare products should they so choose. So
And then,
it,
Randy, I also want to add just also with that general enrollment. So if somebody missed that 8-month period, then, and let's say it's April and they've missed that, that 8-month period of enrolling into their Part B or Medicare, then they can't enroll into, they can go apply for Medicare, but they're not going to get a Part B effective date until the following 2/1 will be the earliest that they get. So right now, this February 1st of 2026 will be the first time that they'll be able to get Part B. They'll get Part A because that's free. They'll go back 6 months for that, but they will not get Part B until 2/1.
Right, which means potential coverage gap for them, right? And potential LEPs, depending on how long they've been uncovered from with Part B, which we'll touch on in just a moment. Let's talk about AEP, your likely favorite time of year, or maybe one of your favorite times of year. I don't know, depends on how you feel about working in general, I guess. But you know, as agents, that last from October 15th through December 7th, and all changes plan changes that happen during that time go into effect on January 1st. During that time, your clients and prospects can join or switch Medicare Advantage plans. They can change from a Medicare Advantage plan back to original Medicare, so just parts A and B. They can join or switch their drug plans, or they can drop Medicare prescription drug coverage completely, although there's not very many good reasons to do that. It is an option. Not to be confused though with MAOEP, which is built specifically again just for folks who already have Medicare Advantage as of January 1st of each year. During that time, they can switch their MA or MAPD plans, but you can't switch like just your drug coverage if you're just have a Part D plan. It's got to be an MA or an MAPD you're switching. Or if those folks would like to, they can return to original Medicare with or without a prescription drug plan, although we would always encourage them to pick up a prescription drug plan to avoid any LEPs later on. Again, only one plan change is allowed during that period, and changes go into effect the first of the month after the plan gets the request. So if you make the enrollment on March 20th, they would have that coverage effective on April 1st. We should point out, though, that during the MAOEP, beneficiaries with original Medicare cannot enroll in an MA or an MAPD plan for the first time. So you can't decide to go from original Medicare to a Medicare Advantage plan during that time. You can only do that during AEP, nor can you use the MAOEP to make any changes to your Part D coverage. If you're in a prescription drug plan on January 1 and it's only a Part D plan, that's your prescription drug plan for the rest of the year, barring any other special circumstances that would permit a change. So a significant difference between AEP and MAOEP, or Medicare Advantage Open Enrollment Period, is which of the following? Is it A, beneficiaries have more flexibility in purchasing prescription coverage during AEP? B, beneficiaries have more flexibility in purchasing prescription coverage during MAOEP? Or C, beneficiaries may only return to original Medicare during MA Open Enrollment? Which of those is true? Even maybe more than one of them is true. Just take a quick look at all of them and put the letter in the chat, please. And if you are thinking A here, right, they have more flexibility in choosing prescription coverage during AEP, you're absolutely right. Remember, during that MAOEP, they only have the option to switch their Medicare Advantage plan, not switching drug coverage. And during either period, they could choose to return to original Medicare during either AEP or MAOEP, both of which are an option for them. Debbie, anything else to add here before we talk about ESRD?
Nope, not at this time.
All right, let's keep rocking and rolling, but let's go the right way with the mouse slides. So let's talk about ESRD. More and more of the population is eligible for Medicare due to this reason. And with more C-SNPs on the market specifically for this for ESRD, really important that you know all the enrollment rules around it. Also really important that you know these rules to help with your AHIP preparation. So killing two birds with one stone here. So let's talk about how someone enrolls with ESRD and how that coverage could work. So say you have a beneficiary, one of your clients is diagnosed with ESRD, their dialysis treatments begin, and so does a 3-month waiting period for their Medicare benefits. But that 3-month waiting period can be waived if a doctor certifies that they can self-administer dialysis, that your client, of course, can self-administer dialysis, and if they participate in a training program approved by Medicare during that 3-month waiting window. During months 1 through 3 of treatment, if applicable, so if they're an employer group health plan, that plan is paying for the care. Medicare does not pick up any responsibility yet, but in month 4 and onward, if they were not originally immediately eligible for Medicare coverage because they weren't able to self-administer dialysis, that's when Medicare kicks in, and you see a 30-month coordination period with the group health plan. Medicare pays secondary from month 4 onward. Coverage for ESRD ends either 12 months after dialysis treatments end or 36 months after a kidney transplant, but it can be resumed or extended if dialysis resumes or another transplant occurs within 12 months after dialysis stops, or if dialysis resumes and another transplant occurs within 36 months of the first. So if they need 2 kidney transplants within 3 years, that would extend their Medicare coverage during that time. Often folks who are in, who have end-stage renal disease, they will need immunosuppressive drugs. So we should also point out that Part B does offer an immunosuppressive only drug benefit that does cover only those drugs beyond the original 36 months if they had the drugs after an organ transplant and the beneficiary has no other health coverage with an immunosuppressive benefit. Problem, well, not a problem, but most sources of insurance will have an immunosuppressive benefit. Think marketplace coverage, likely embedded in your plans there. Most group health plans will cover that here, but it's really just a safety net for folks who don't have coverage from another source. The benefit does have a reduced premium, so you're not paying full sticker price for Part B if you're only using this, but you're only getting coverage for immunosuppressive drugs and no other items or services here. And so we should point out that it's not a substitute for full Part B or other health coverage. It's really just a safety net for those who don't otherwise have coverage for immunosuppressive drugs. Let's say your client is diagnosed with ESRD and has begun dialysis. The client's not currently covered by an employer group health plan. Which of the following statements are true? Is it A, there will be a 3-month waiting period for Medicare benefits to begin? B, that 3-month waiting period can be waived if a doctor certifies the patient can self-administer their dialysis treatments? Or C, the client is not eligible for Medicare coverage until they turn 65. Sorry, Charlie, no Medicare for you until you're of age. Which of those is true? Keeping in mind more than one could be true. And there's both A and B are true in this case. C and some, yep, and as some of you were chatting publicly, some of you chatting privately. But yeah, A and B are both true. Yes, it's true. There's a 3-month waiting period. It's also true that period can be waived if a doctor certifies that they can self-administer their treatments. Both of those are important. Though, because you'll need those Medicare benefits in order to enroll in additional coverage like a C-SNP to help with some of these conditions. Debbie, what else do we need to know about ESRD?
Sorry, couldn't get to my mute. No, you have everything pretty well covered with ESRD. So unless you guys have any questions, I think everything looks good.
All right, thank you. Let's talk about LEPs. We've been alluding to them for a while, but it's also always important to know what they are, what they look like, and who can be impacted by them. Let's talk first about Part A. Part A, you're not going to run into very often. Something like 95% of enrollees do not incur late LEP for Part A because most of us do have enough work credits, or most people do have enough work Social Security credits and quarters to qualify for premium-free Part A. But if you are not eligible for premium-free Part A because you don't have the work history, maybe you're a recent immigrant, or maybe you were a shade tree mechanic, never filed taxes, or whatever the case might be, that's where your Part A premium and Part A penalties can really stack up. So with some exceptions, this penalty does apply if someone did not enroll during their IEP and for whatever reason, they're not eligible for premium-free Part A. That is a 10% increase to their monthly premium, and the penalty is in place for twice the number of years enrollment was delayed. So for example, if they enroll in Part A 2 years after being eligible, they have a 10% penalty added on their base premium, but that 10% surcharge is in place for 4 years. So the Part A penalty does go away eventually, but other penalties that we'll talk about do not necessarily do so. So let's add Part B penalty into the mix here. With some exception, Part B penalties apply if your person did not enroll during their IEP. Is a 10-month increase to the premium for each 12-month period that enrollment was delayed. And that is a full 12-month period, not a partial 12-month period. So For each year that enrollment was delayed, that 10% increase gets tacked on. Penalty is in place for as long as the beneficiary has Medicare or has Medicare Part B, which means for a lot of folks, it can be a lifetime penalty, and lifetime penalties can be costly. So we always want to caution against that. Let's show you how costly it can be. So we have Opal here. Her initial enrollment period ended on December 2019. She waited to sign up for Part B until March 2022 during her general enrollment period, and her coverage became effective on April 1st, 2022. Because she was uncovered for 2 full 12-month periods, she has a 20% premium penalty, and that'll have to be tacked on for as long as she keeps Part B. So be mindful of that. Let's also talk about Part D. That Part D penalty does apply when someone either does not enroll when they're first eligible for Part D, or they have a gap in creditable coverage for longer than 63 days. Part D penalty is determined because CMS takes a look at all of, pardon me, the Plan D premiums around the nation, figures out what the average premium is, and figures out what 1% of that is. They multiply that 1% times the number of months you should have had Part D but didn't, and tack that onto the beneficiary's monthly premium. That penalty is also a lifetime penalty. It's in place for as long as the beneficiary is enrolled, and so that can add up quickly as well. So we have Tarek here. Tarek is currently eligible for Medicare, and his IEP ended on July 31st, 2020. He doesn't have coverage from another source or drug coverage from another source, and didn't join by July 31st, 2020, and instead joined during the OEP that ended on December 7th, 2022. His drug coverage became effective on January 1st, 2023. So what could he be responsible for? Since he was without credible drug coverage from August 20th through December 2022, his penalty in 2023 was 29%, 1% for each of the 29 months of $32.74, which was that national base premium, or $9.49. Let's take a look at the math behind that. He's got that 29% penalty times the base premium, comes out to $9.49. But remember that Part D LEPs are always rounded to the nearest dime, so it goes up to $9.50, and that is his monthly LEP for 2023. But because the national premium is recalculated, or the national beneficiary base premium is recalculated each year, the penalty can change each year. So in 2024, his obligation increases some. In 2024, the base premium was $34.70. Doing the math there, the 29 times that $34.70 gave us $10.06. Running that to the nearest time is $10.10, which means his penalty is increased to $10.10 per month throughout 2024. And again, as the premiums continue to increase, they never go down. That can compound fairly quickly for your beneficiaries. So always helpful to know what the penalty can look like and also know how to avoid them. So just putting all three side by side, remember that Part B and Part D are always in place as long as they're enrolled. Part A is the only one that can drop off for your beneficiaries. And by the way, it reminds me of a question I wanted to ask you. In most cases, the only late enrollment penalty that ends while the beneficiary is enrolled in Medicare is it A, the Part A late enrollment penalty, B, the Part B LEP, or C, the Part D LEP. Which one is the only one that will end while the beneficiary is enrolled? Yep, A is the only one that will end while they're enrolled. Part B and Part D you're stuck with for as long as you have coverage. Debbie, what else is on your mind about LEPs or anything else?
Yeah, just a friendly reminder that if your client is past the age of 65, they're always going to get a letter from the carrier asking for to provide proof of having a Part D plan in place at age 65. This isn't anything we get a lot of times that lately we've been seeing a lot of LEPs added to the plan. These cannot be removed by you or by us without the member doing an appeal. The member usually has 30 days with the carrier to provide proof. So it's very important when you sign them up for these drug cards or MAPD plans or PDP plans that they're going to possibly get a letter with a form they must fill out. So just make sure they're aware of this so that it's not a surprise that 3 months later they have an LEP on their policy. So just want to put that out there.
Should also mention that if you or your beneficiaries need help estimating their LEP or possible LEPs for any of parts A, B, or D, there is a calculator available at our website. You can tool around in our navigation menu. When you hit the end of today's session and are taking you off to the training calendar, you'll be able to see that in fairly short order as well. Let's talk about Medicare supplements and their enrollment opportunities here as well, because we want to give everybody equal love here. Two big things to know about Medicare supplement enrollments. You can either enroll with guaranteed issue rights or enroll without guaranteed issue rights. Generally speaking, folks have that supplement open enrollment period or their Medicare supplement open enrollment period. That is a 6-month window that begins when the beneficiary is 65 and enrolled in parts A and or B. During that time, they can enroll in a Medicare supplement plan free of medical underwriting. So they're guaranteed the best rate that the carrier can offer in that case. And they do have access to other periods with guaranteed issue rights when special circumstances apply, typically in relation to the loss of coverage, maybe, for example, losing their employer group coverage, or maybe their med sub closes up shop in the middle of the night, or similar such circumstances. I would give them a GI right to be able to enroll in a plan without going through medical underwriting. But outside of those GI windows or outside of that open enrollment period, you have non-guaranteed issue rights. You can enroll in a med sup at any time throughout the year, but you may be charged more based on medical conditions. And depending on the carrier, you could be denied coverage if they apply during that period as well. For example, if you're doing business here in Michigan, Blue Cross Blue Shield of Michigan will accept everyone outside of their GI period. They will uprate them based on their medical underwriting. Other carriers that operate in Michigan, like a Priority Health, will deny folks for health status for Medicare supplement. So always important to keep in mind. Generally speaking, though, the best way to avoid any LEP and ensure access to a wide variety of medical plans is A, sign up during the IEP, B, sign up during your IEP, or C, sign up during the IEP, which is some of the best advice that you might give to your clients going forward here. Yeah, absolutely, right? If there is the one way we could all, improve the world, would be to tell everyone to take advantage of their IEP when they need to, right? There's some employer group situations where they may not need to just yet and needed to use the SEP, but gosh, wouldn't the world be a little bit easier if every beneficiary knew they could take advantage of their IEP and really make good decisions about their coverage at that point. Debbie, what else do we need to add about MedSup or anything else that's on your mind?
Nothing well with the med sup. Just remember that yeah, Blue Cross does guaranteed issue for everything. If they are losing group coverage when you do the enrollments, you have to upload the group term letter. If they don't have it, it won't be able to, we can't complete it. So we have to have something showing with the other carriers. And you know what? The only thing we can say is if you want like a Priority Health or WellCare or any of those other plans that I have supplementals, go ahead and put it in and see what kind of rate they come up with. You'd be surprised. Sometimes there's people that they accept and it goes through. They may get a little higher rate, but it still might be worth the try. So,
Yep. And we'll talk more about MedSup ratings next week. And we have a session, or next week rather, we have a session fully dedicated to MedSup. And we'll talk a little bit about how some of the carriers rate on that as well. We also promised some discussion about coexistence coordination. So that's our last big chunk here today. Excuse me for just a moment. There's a crud going around the office, and I currently have some of that crud. Please don't come see me at the moment. Let's talk about coexistence and coordination and what we're talking about here. So know that every type of health insurance coverage your folks may have, and I know your insurance agents, you know this, but they're all called payers, right? No matter which source of coverage they have, it's a payer, whether it's the government or a private plan or something else. When there's more than one payer, there is a whole book, several books, all kinds of laws that dictate the coordination of benefits rules that decide who's going to pay first. There may be a primary payer, there may be a secondary payer. In some cases, depending on how your person is covered and by how many sources your person is covered, there could be tertiary payers there as well. Tertiary is just much more fun to say than third payer. Briefly speaking, let's take a look at this chart. If there's one more thing you screenshot here today, I would take this, put it on your wall here as well, because it's a really helpful reminder of how all these various sources of coverage can work with Medicare. If someone is in a group retiree plan, that plan can coexist with Medicare, so they can have them both. Medicare will be the primary payer in that case, so long as the member doesn't have any excluding conditions like the black lung they were working a coal mine forever, for example. There's other government programs that help address that, but Medicare would not kick in specifically in that case. If they are in an employer group health plan for whether they are enrolled in that plan or their spouse is enrolled in that plan, that coverage can also coexist with Medicare. Medicare will be primary if the employer has less than 20 employees. If the employer has more than 20 employees, Medicare may pay secondary. And again, that 20 employee threshold is important for a lot of reasons. One of them being that when Medicare becomes a secondary payer, your folks may forego enrolling in Part A or B without penalty in that case, so long as they take advantage of the appropriate SEP later on. If they are under 65, disabled, and enrolled in an employer group health plan, yes, that coverage can coexist with Medicare. Medicare will pay primary if the group has less than 100 employees. If they have more than 100 employees, Medicare will pay secondary. If you have end-stage renal disease and are enrolled in a group health plan, that will also coexist with Medicare. Medicare will pay primary after that 30-month coordination and benefits period we talked about a bit earlier on in the session. If someone does have Medicaid, that also coexists with Medicare. And again, we'll talk more about Medicaid, Medicare, and Medicare savings programs in a session coming up next month. Medicare is the primary payer in this place. Medicaid is always the payer of last resort. And we should also point out that balance billing is always illegal for qualified beneficiaries. So if you have someone that is a QIMBY and they're receiving bills from providers, that's a big old no-no, and you can really help earn some goodwill by making sure your beneficiaries know that. If you have someone that's enrolled in marketplace coverage, generally speaking, that cannot coexist with Medicare is once you're eligible for Medicare, because Medicare eligibility disqualifies you for tax credits and other savings here as well. That's Uncle Sam's friendly reminder of saying, we have another government program for you. Go join Medicare instead. So let's visit Hector. Hector is 64 and 9 months. He's employed with a small 8-person web design firm. He's enrolled in the firm's group health plan and will enroll in original Medicare during his IEP. He wants to keep working till he's 70. Which of the following statements is going to be true regarding his medical coverage? Is it A, Medicare will be primary for any medical expenses he incurs? B, Medicare will be secondary for any inpatient hospital expenses he incurs? Or C, there will be a 30-month coordination period between the employer group health plan and Medicare as he's enrolling here. Which of those is true? Yep, and we're exactly right here. Because the group is smaller than 20, Medicare will pay primary. So Hector better enroll in Parts A and B as soon as he's eligible. So Medicare can pay primary. Debbie, anything else to add around that rule of 20 or other coordination issues that you might see before we talk about veterans coverage and PFL?
Well, just that third line where it was about the under 65, we get so many calls with agents like surprised at the members on disability, and then we do a little bit more research, we find out that the group is under 20, so that's why they're having issues. So it's very important that somebody under age 65, even though your group is, we do the under 20, over 20, but when it comes to under 65, it's the over 100, under 100. So if that member or spouse, you're on a group that's under 100, they have to take B to get that good coverage. So that third line, very important to put that in the back of your mind. 100 employees is the rule for under 65. So
Yep.
we get a lot of calls on that. So
Yep. And hopefully this chart, if you do paste it to your walls, will be a good reminder of that going
of
forward.
course,
Not that
Yep.
we're not happy to answer your calls, but can save your clients a lot of headache if we're proactive about that going forward. Let's talk about veterans coverage here as well. The VA itself does strongly recommend that folks do enroll in parts A and B when they first become eligible, and there's a few reasons why. First one is that depending on what Congress is willing to fund or not fund that year, VA health coverage isn't the same for everyone when they enroll. So coverage can always be flexible and is always subject to whatever Congress and the executive branch are willing to spend on VA health coverage. But enrolling in both the VA benefits and parts A and B greatly widens your folks' coverage options. They can get treatment under either program. Their VA benefits, of course, can be used at a VA center or pre-authorized to be used at a non-VA location, but their Medicare benefits can be used at any provider that does accept assignment, and it may pay for non-VA covered services at those non-VA locations here as well. So you're really helping protecting your veterans by helping them enroll in parts A and B or counseling them to enroll in parts A and B when they're available. And we should also point out that LEPs for Part B could apply in the future. If they do lose their VA benefits and go uncovered, that could expose them a little bit later on. We shall point out, though, that VA benefits do count as creditable drug coverage, so there is no penalty for Part D if they choose to waive enrolling in a Part D plan. The VA coverage does count as drug coverage, so there's no exposure there. We should talk about TFL, or TRICARE for Life. When military retirees use coverage for services covered by both Medicare and TFL, Medicare will pay primary, but TFL will pay secondary. They'll pay the remaining in that case. For services covered by TFL but not Medicare, of course, TFL is the only payer, so they'll pay first, and Medicare won't pay anything. But for services that are gotten in a military hospital or other providers, TFL will pay first, and generally Medicare does not work in those facilities, so generally Medicare will pay nothing for those, with some exceptions, fewer and farther between. Let's talk real quickly about Joseph, who's 89. He's a veteran enrolled in original Medicare, TFL, and VA benefits. He's hospitalized in a non-VA facility for a condition not related to his military service, which will be true about his Medicare covered care. Is it that the VA will be the primary payer, Medicare will be the secondary payer? B, Medicare will be primary, TFL may be a secondary payer, or C, TFL will be primary and Medicare will be secondary. Which of those will be true? Yep. In a non-VA facility, Medicare is going to be the primary payer here, especially the giveaway for us here is the conditions not related to his military service. So we know that is just a run-of-the-mill as health issue as he can get here. Medicare is going to act primary here. TFL could pick it up later, depending on the specific claim. We also want to spend some time with Medicare and COBRA. We get a lot of calls on that. We've alluded to this here throughout the session. We want to make sure we give it a few minutes of its own attention here before we close up shop for the day. When we talk about COBRA, we are talking about the Consolidated Omnibus Budget Reconciliation Act, or COBRA for short. A few things to keep in mind about COBRA, because it's not just 18 months, as a lot of folks tend to have grilled into their heads. What COBRA does allow folks to do is continue their group health coverage beyond their time of employment in the case of voluntary or involuntary job loss, if there's a reduction in their hours worked, if they're between jobs, or due to death, divorce, or other life events. In general, COBRA does only apply to employers with 20 or more employees. So our folks who are leaving their smaller firms or retiring from their smaller firms are not eligible for COBRA. So it's imperative they are enrolled in A or B, or should already be enrolled in A or B before this goes forward. Cobra coverage generally is offered for 18 months, but is available to some for 36 months in some cases. Say, for example, if a covered employee becomes eligible for Medicare, the spouse can elect Cobra for up to 36 months. Or if there's a divorce or a legal separation, again, that divorced spouse or the separated spouse can that was not the subscriber on the group health plan can elect to those Cobra benefits for up to 36 months as well. But there's a neat flow chart I want to share with you here before we leave here today. Say we have someone that does experience a life event that leads to Cobra eligibility. So they are separating from employment for whatever reason. If they do enroll in Medicare while on Cobra at any time, so they take Cobra first going down this left-hand path, they lose that Cobra eligibility as soon as they become enrolled in Medicare. So then they're looking for Medicare plans at that point. And finding a source of coverage there. But if they enroll in Medicare, so Part A and or B, before they chose Cobra, so going down the right-hand path, they can't elect Cobra even if they were only enrolled in Part A. But even if that's the case, to avoid that Part B LEP, they should enroll in Part B before that Cobra election. So there's no worries about the LEP there. The Part D LEP could be avoided if Cobra coverage is considered creditable. So if the employer group drug plan was at least as good as what Medicare could offer, they may not need to pick up a Part D plan. But again, that depends on specifics of that plan. Debbie, I know we get a ton of questions about this. We'd love to hear your thoughts on this before we wrap up for the day here.
Well, as I said before, the biggest thing is just when they lose their employment, make sure they get to get that Part B enrollment. Some people stay on it. They get Medicare Part A, get Part B, they stay on the Cobra benefits and then decide, well, wait a minute, I'm paying all this money. It could be paying zero premium for a MAPD plan. You can actually disenroll from a Cobra plan at any time. It's not like the under 65 where you have to wait for their OEP. You don't have to do that with Medicare. So if you're on Cobra with Medicare as primary, you can leave Cobra at any time and enroll in a MAPD or as a guaranteed issue for a supplemental plan as well with a PDP. So a lot of people don't realize that. So that's the biggest thing. But getting signed up, sign up, sign up.
Yeah. The key difference, though, is that the SEP that you get when Cobra ends is not met for Medicare Part B, right? So you only have that
Right.
8-month window to pick up your Part B, but you
Yep.
do get an SEP for C and D when your Cobra coverage ends. So lots of things to
Correct.
be aware of there.
Yep. Correct. Yep. That's it.
All right. Well, let's talk about what we've talked about here today. Give you a quick recap to wrap everything up in a little bow. We talked about special enrollment periods and all those enrollment periods. We talked about LEPs and we talked about how Medicare can coexist with private carriers and programs. We laid out this neat chart for you where we talked about all 5 of these opportunities that folks have to enroll in Medicare, introduced some of us for the first time or reacquainted some of us with the general enrollment period where they can pick up parts A or B during that time or year. And of course, reminded ourselves of some times where there's automatic and manual enrollment during that initial enrollment period as well. We talked about LEPs and we reminded ourselves that Part A is the only one that drops off over time. Part B and Part D are lifetime penalties. That Part D penalty is recalculated each year and can add up pretty quickly, especially as premiums continue to go up because, just, again, they never go down. And we talked a bit about how Medicare works with other programs. Debbie pointed out that under 65 rule here. Again, great opportunity to put this in your notes somewhere. Take a look at it. When you're asked a coordination question on your AHIP exam, this should get you through a good portion of what you might need to navigate. All that said, ladies and gentlemen, thank you for your time and attention here today. We always love spending time with our agents. Thank you for those of you who professed your love for us at the beginning of the hour here today. Either at the end of today's session or in an email with tomorrow's recording, you'll get an evaluation, a little survey. Let Debbie and I know how we did today, whether we met your expectations, exceeded them, or didn't quite get there today. We'd love to hear your thoughts either way. You're always welcome to get in touch with Action Benefits via any of these channels. You can always find us on LinkedIn at the Action Benefits Company. Email me and my team at learning@actionbenefits.com or Debbie's team at individual@actionbenefits.com, or reach out to anyone on our main line. Brenda or someone else will get you in touch with who you need to talk to at 248-356-8585. Debbie, before we wrap up, any other parting words for the good or the order?
No, just keep in mind, there's 8 strong members of our team, individual team. We're here. We're all knowledgeable about everything that's going on with Medicare and even under 65. So just keep in mind, we're here for you. Call us or email, like Randy said, at individual@actionbenefits.com. More than happy to help you. And we look forward to talking with you on the phone. Thanks for your business.
Thank you for joining us here today, Debbie. She is the best, isn't she, Lisa? They're all the best, actually. It's like picking a favorite child. You can't. Train of thought just left. Anyway, thank you all for coming here today. Appreciate you spending the time with us, and thank you, Debbie, for sharing your knowledge and expertise with us here today. I look forward to seeing you all again at another Action Academy session. There's a calendar popping up on your screen here as well, so you can enroll in what's coming up next few months. If you carrier sessions already scheduled, if you're interested in product releases, I encourage you to check out the bottom of the calendar, looking at late August, September for those. All that said, folks, ladies and gentlemen, thank you again for your time and attention. Look forward to seeing you all again soon, and enjoy your days.